The Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us for his second segment of the morning.
He is now focusing on the cost of care and how we can make it better for everyone involved.
So, of every healthcare dollar, how much do you think actually goes towards the physicians, PAs, and NPs that are out there? You got a guess?
I think $3.
$3 of every dollar? Goodness gracious.
I meant 3 cents.
I wouldn't necessarily be here.
I'll say 68 cents.
68 cents. All right. Neither too close. It's actually about 15%.
Okay.
So 15% of every healthcare dollar goes towards the physicians, PAs, and NPs, the ones that are administering the care that's there. Unfortunately, the rest goes to hospitals being the largest part, insurance, administration. But the challenge is when you get sick, like many people here are right now, do you go to the insurance? Do you go to the healthcare administration? No, you go to the doctor. You go to the physician, the PA, the NP to try to provide that healthcare to help you get better. The key in our current healthcare system is that we have administrative bloat. The oversight of healthcare, the metrics, everything that goes into it, the administration has grown exponentially while your healthcare workforce has actually stayed rather stagnant. Now the key here looking at efficiency is how do we trim down the inefficiency, the administration, those that don't actually provide your care, while it's still at the same time providing the safety that some of that does. Now the key into getting into that is curtailing some of the costs with our healthcare plans, curtailing the costs of our drugs, decreasing some of the administrative burden that we see within our hospitals, and then making sure that our physicians, PAs, NPs, and nurses can provide that care efficiently when you're there in the clinics and in the hospitals, giving them the time that you need to take care of you. Your physician spends much more time documenting your care than they do administering your care just because of many of those administrative burdens.
It's interesting. You started your segment with a question, so I will close it with a question for you. This $20 bill of mine, how much of it do you think you'll see?
Of yours, probably 0.
0%. But Doc Stanton got it right, yes.
And I'm going to try to go today in the hospital and see if I can turn the $1 into $3, which would be a fantastic investment.
Best of luck.
Yeah, good luck.
Let us know if you pull that off.
Thanks,
The
Doc.
government did take 40%, whatever. Taxes. Hashtag taxes.
We're back with more of the newscasts. Right after this, what's next, guys?
Weather.
Weather.
Justin Logan's
We're going to do
forecast
weather.
next.
We'll see what Justin can do with his money.
You're watching Fox 56 News. Our home, your news.